if you're a baseball pitcher looking for ways to fortify and strengthen your medial elbow to help protect your ligament, I'm going to go over today 3 common exercises I will use either from a training standpoint or rehab standpoint to protect that medial elbow. What I want to preface more than anything before we get totally rolling into these exercises is that the exercise I'm going to go over today, while yes, they are helpful for the medial elbow and can help strengthen it, they are one small piece of the puzzle. There has to be a good, consistent strength training year round. You need to be able to have a good, solid, we'll call it arm care, but the ability to strengthen and isolate the rotator cuff and shoulder musculature from itself. But again, really more than anything, if you do not have those other factors, good strength training year round, addressing the shoulder, good recovery, monitoring workload, if you don't have those 4 things in line, a lot of the stuff we're going to be doing here is really not going to actually, in my opinion, truly protect the medial elbow. And while we can't 100% prevent injuries, there's a lot of stuff, just like I mentioned there, in addition to the drills we're going to go over today, that can help protect the medial elbow, specifically that UCL, that ligament. So, a couple of variations I'd like to do. First one I'll maybe start with is a finger plate hold. So, I have a 25-pound plate here. So, you're going to kind of take this almost this long finger kind of pinch grip. You're going to go right around the plate here, and we're just going to hold it in this position here, okay? If you can see here, I have a little bit of space through there, so I don't want it totally resting there. You have a little bit of a gap between, it's going to make it even harder for those finger muscles more than anything. So you can either do a static hold, you could do a farmer's carry, you can do a lot of different things with this. But this is one variation. I'll maybe start with 30, 45-second holds and then gradually drop down 15, 20 seconds at a higher weight, okay? So that's one way we go about that. The next way we go about is strengthening what's called your FDS, your flexor digitorum superficialis, which is one of your main stabilizers of the medial elbow that sits directly on top of your UCL. So what I'm going to do here, so I like to have a J hook here more than anything. So you kind of see this J hook, there's a curve here. I'm going to have my 3 fingers here kind of looped right around the curve of that J hook. I'm out in front here, and all I'm doing is I am pulling essentially this way towards me. So I'm pulling towards me. The reason I like doing the J hook is the J hook's not going to move. You can monitor your intensity as you want, okay? So you're pulling down here, and again, the biggest thing is I'm pulling, I'm not flexing at the wrist. I'm pulling that way. Again, I'll start 30 to 45 seconds, some lower intensity, longer holds at first so it doesn't light someone up. But that's the first way we go about strengthening that. And then really, again, the benefit is you can, with anything like this where you start with a longer duration isometric, you can progress to higher intensity, shorter duration isometric from a strength standpoint or from a rate of force development, so an RFD standpoint as well. So again, this is one drill here. If you don't have a J hook, you just want to use a beam or a wall, that's fine. You come right around the beam and pull in like so. The last one I like to do is for strengthening that FCU, which again, your flexor carpi ulnaris, one of your other big stabilizers for the medial elbow. So what that's going to look like is I like to have a band here, and I like doing a lot of stuff out in this extended position at first. I'll later at some point get them up to this kind of 90-90 position. This is a very vulnerable position for a lot of guys. We have to make sure that that tendon and muscle that we're working is essentially fortified enough to be able to withstand that position from an exercise standpoint. So I'll have them out in front, and I kind of might have them kind of choke up on this a little bit, and then all they're doing from here is they're just dipping down. So you should feel it's right along the inside part of that elbow there. So I might go for reps where they're going through it here. I might go for just an isometric hold, or I might do a combo of the two. When I go that isometric hold, I might step out or lean a little further and get some more tension on that band, and that's going to make it more challenging. So again, if you're going reps, you go a little bit higher rep to start, or a little bit long. If you're going isometrics, go a little bit long duration, and then you eventually start to progress the variables on the 2 of those. So again, those are 3 movements I like to incorporate, not only from a training standpoint, but from a rehab standpoint, especially if it's an elbow or even a shoulder rehab that we're working with. But those are 3 things that are a very small piece of the puzzle. If you do just those 3 things alone, without doing all the other stuff I talked about, good nutrition, sleep, workload, year-round strength training, you're not going to have the effect that you want to with this. Like, true injury, decreased injury risk is multifactorial, meaning it's not just one thing. You can't listen to someone just say, this one exercise alone is going to solve the UCL epidemic. That's a bunch of nonsense, and that's just kind of that's just kind of people's way of just trying to really do a lot of clickbaity stuff, in my opinion, more than anything. So, again, try those 3 things out. Start light. You can do them 2 to 3 times a week, and you can kind of gradually progress them as you get comfortable, and just really include them into your training program. So like when you have a lift, do them at the end of your lift or during it. There's a lot of good ways you can implement that. So again, if you like drills like this, you like this content, go ahead, subscribe to our channel, or leave a comment below with any questions you have on just whether it's training or rehab oriented.